Welcome to the Healthy Home video series. I'm Brian Dunbar, Director of the Institute for the Built Environment at Colorado State University. When we spend more time in our homes, we realize just how important a healthy home is. This series is dedicated to sharing ideas and advice for creating and maintaining a healthy home during the coronavirus pandemic and beyond. Be sure to also refer to guidance from the CDC, the World Health Organization, and regional health and government agencies. I'd like to welcome Kevin Kennedy. Kevin is environmental hygienist and the program director of the Environmental Health Program at Children's Mercy, Kansas City. The nationally recognized Environmental Health Program provides patient families, child care centers, and schools with resources to identify and reduce indoor exposures that may contribute to health problems for children. Kevin and his team performs research on indoor environmental health issues, focusing in part on home assessments, which entails visiting homes and providing customized healthy home recommendations. So Kevin's going to talk to us about 8 principles of a healthy home. All of us should routinely consider these principles. And if you or someone in your home may have coronavirus or another illness, Kevin's tips can help reduce the risk of spreading the illness. So Kevin, let me ask you first of all, you work at a hospital, so why are you concerned with housing?
The idea is that when we take care of our health, we don't take care of our health in a hospital or a clinic. We take care of ourselves and our families in our homes, and the home itself plays an important part in that total health. At Children's Mercy, we advocate for healthy home best practices for all children, but in particular for those that are more vulnerable to things they might be exposed to in the home. This is particularly true for children with allergies or asthma, or those that are immunocompromised or have immunodeficiencies.
So Kevin, is there a systematic framework that people could use to make their homes healthy?
Yes, there is. That is this framework that has been around for many years. It's called the Keep It Principles of a Healthy Home. It's comprised of 8 key principles, each of which is pretty easy for people to remember and to apply in their own home.
And what are those 8 principles, Kevin?
They are keep it dry, clean, pest-free, ventilated, safe, contaminant-free, maintained, and climate-controlled or comfortable is the new term they use for that. So the idea is under keep it dry, it would be just good moisture management to prevent any kind of excess water or dampness in your home. And then keeping it clean is, of course, reducing exposure to excess dust and allergens through just regular cleaning practices to reduce these contaminants in our homes. Pest-free is a practical strategy to prevent pest infestations, and really it's geared towards avoiding the use of pesticides when they're not needed. Keeping it ventilated is the idea that all homes need some kind of fresh air coming in, and also specific strategies for removing pollutants, like using exhaust fans around bathrooms and kitchens. Keeping it safe is this focus on injury prevention as a way to keep people from being harmed when accidents do happen. And contaminant-free is the idea of avoiding having certain things like secondhand smoke or hazardous chemicals in our homes and finding and choosing safer alternatives. Keep it maintained is the concept that all things in our home need to be taken care of with regular servicing and repairs to make sure they work properly. And then keep it comfortable is this overall strategy of a home being energy efficient and thermally controlled to avoid it being too warm or too cold inside a home.
So Kevin, why do they call it Keep It Principles?
Well, that's because Keep It is really more of a strategy that begins with the concept of keeping your home in a particular way that's good for your health and for your family's health. they aren't just one-time activities. It's not one thing you do and then you're done. It's really something you do and then you sustain it over time. So it's sort of changing your practices in a home. So each principle should be integrated into your simple, regular routine that you follow in managing your home. And that would include both how you take care of your home, but also the purchases you might make, say cleaning products or furniture or things you might bring in to renovate your home. All of those things would be something you'd be thinking about. And in some cases, you take an initial action to make it healthy to start, and then you do other actions to keep it that way.
Kevin, right now, a lot of people are concerned about the coronavirus. Are any of the principles in your list particularly important when it comes to viruses?
Yes, absolutely. I think one can say that right now, it's vital that people implement some of the Keep It principles, and 4 of the Healthy Home principles are particularly important when thinking about controlling viruses. 2 are of important focus. So keep it clean. Of course, we've already kind of mentioned that, and many people are thinking about that. So when we think about keeping it clean, people are hearing about the need to disinfect, but they need to do both. There's important cleaning steps that need to be done first before they actually disinfect. Otherwise, the disinfectant they're wanting to use isn't anywhere near as effective. Just simple cleaning with soap and water actually destroys the coronavirus particles themselves, but you really need to also remove the dirt and film and filth off of surfaces before you apply a disinfectant. Of course, following the instructions on the package of the disinfectant, but you need to treat those surfaces first by cleaning, and then you can disinfect properly and effectively. There are, fortunately, many good cleaning products that are both plant-based and organic, so there's some good alternatives out there that people can use. Another important component that people really need to think about is good hand washing technique, good hand hygiene. They want to minimize the transfer of the virus to things in their home from outside the home, and your hands are one of the most important things that you need to wash and take care of because they come in contact with all sorts of surfaces inside the house. So it's important to wash them regularly, especially if you've been out. And then in that process, there is a right way to wash them, a thorough way to wash them. And that really takes about 20 seconds. For many people, it helps to just sing a simple song like a children's ABC song that you learned when you were little, so that you take enough time to wash your hands thoroughly. So it's a stepwise process. Clean your hands first, then clean surfaces, and then you can disinfect those surfaces and have it be effective. The other important Keep It principle is contaminant-free. So now that you're using these agents to clean surfaces and for disinfectant, there are a lot of vapors in the air that can actually make people pretty sick. So you want to make sure you're using the right amount of the vapor and not too much. And remember, the cleaning agents themselves can react with other cleaning agents or react with disinfectants. So they can actually be dangerous if you buy products that don't mix or shouldn't be mixed together. A couple of examples would be ammonia and bleach in products can be very dangerous if they're actually mixed together. There's actually been a big increase in poison control calls related to exposure to cleaning agents and disinfectants as people have bought these and started using them. So we really want people to use them correctly, to read instructions, and avoid being hurt just because they're trying to make their home cleaner.
Kevin, this is great information. I appreciate you separating out this the idea of cleaning and disinfecting. What products are the safest and healthiest to use for disinfection?
Well, fortunately, the Environmental Protection Agency in the United States has for many years maintained lists, and they actually register and certify disinfecting products. So they have something called the N list, which is one of these lists of disinfecting agents. And the N lists are those products that are approved for use on surfaces. So again, you would clean a surface. Once it's clean, you can apply this disinfectant to the surface to destroy viruses. So if people look at that list, they'll find there are many common brand name products that are actually on that list and that are available in stores, but that's a good place to look to ensure that it's an approved product for dealing with viruses.
Great, thanks, Kevin. Now, in addition to clean and contaminant-free, you mentioned there's two other principles that are important in the face of coronavirus.
That's right. So keep it ventilated is another important one. So we've talked about cleaning and contaminant-free and some of the vapors that might be generated from doing that kind of activity in a home. So it's important that we operate our mechanical systems, our air conditioning, our heating systems, so that they properly remove any of those airborne chemicals that might build up in a home where you've done lots of cleaning. And then if you actually have someone in the home who's COVID sick, then it's important to take some extra precautions in using your ventilation systems.
Okay. So Kevin, we do have another video where we talk with Paul Francisco about the ventilation, and we go kind of in depth with all the various things you can do with ventilation. So thanks for mentioning that one. And what's your last principle?
The last principle is just keeping it maintained. It's, the idea that all of these other keep it principles you're applying in your home, but maintaining things covers all of the principles. So routine vacuuming, routine cleaning, making sure those heating and air conditioning systems have been serviced and are working properly, ensuring the doors and windows open properly and making sure that you do open and close them on a regular basis, making sure any of the vents in the house aren't blocked or that exhaust systems work correctly, simple practices like that.
A lot of good tips you're giving us, Kevin. Are there any more important tips that you'd like our viewers to know?
Well, I think it's important for people to realize that in this time of a dangerous virus, this is a particular dangerous virus, but people are exposed to viruses and bacteria all the time. There's no such thing as a home that is completely virus or bacteria or microbe free. It is normal to have these organisms in homes, and actually some of them, certain bacteria, are actually healthy for people, but it's hard for people to understand that there is this difference. But when a dangerous agent like COVID-19 becomes available and people become infected, that's when it's important to be smart about doing effective cleaning and disinfecting, but not overusing products. There's no reason to use them in excess. Just be smart about the use of products and recognize that your goal is to use them while COVID-19 is a concern, and then after things maybe have calmed down, you may not have to use them as frequently.
Kevin, you've given us a lot of information, and yet you have a good job of keeping it simple. You've straightened some things out for me, and I'm sure many other viewers. This information helps us to both make and then keep our homes healthy, and can reduce the risk of infection from the current pandemic. And every day, pandemic or not, we can keep our homes healthy by applying those keep it principles that you've shared with us. And let me just go over those again: dry, clean, pest-free, ventilated, safe, contaminant-free, maintained, and comfortable. It's really that simple, thanks to Kevin. So Kevin, I want to recognize and acknowledge your information, and thank you for the focus that you have on our healthy homes.
You're welcome. Happy to be here.